22 hospitals across the country are now exempt from power cuts. It's a start, but the health department actually listed 212 hospitals as priority facilities. 2022 has been the worst year on record for rolling blackouts. We've been in darkness for a combined 2,234 hours. Or 92 days. Devastating to the economy and beyond just an inconvenience to South Africans, blackouts are potentially dangerous at hospitals. Let's get an update on how long it'll take to ring-fence all priority facilities. I'm joined by Foster Mohale, who is spokesperson for the health department. Thank you very much, Mr. Mohale, for your time this evening. So from 37 hospitals to 72 since September, that's an additional 35 hospitals now exempt from load shedding. Where are they located by province?
Good evening, Hanley, and good evening to eNCA listeners and viewers, and thanks for this opportunity. Yes, indeed, we believe as the Department of Health, working closely with Eskom and the provincial authorities, we have made a great progress in terms of the number of hospitals that are exempted. But we believe that we still have got a long way to go. As you remember that the list of hospitals that we've submitted to Eskom is about 212. But this is not the total number of hospitals in the country. So we believe that we still have got a long way to go. But we believe that what we've done so far is great progress. But also remember that the hospitals which are not yet exempted, they still have got the backup generator and the uninterrupted power supply.
So 72 out of 212, that leaves 130. So we're at about a third of the way there. How long do you estimate it's going to take to get to that target of 212?
Yeah, as we have announced that this is going to be a phased approach. It's not possible that we can be able to exempt or exclude all the hospitals at a go because of a number of technical challenges that we have announced 2 days ago, that especially with regards to the way in which the electricity configuration is being done. For example, a number of we've got about 28 hospitals which are deeply embedded on the system, meaning that they are sharing the line with a number of Eskom clients, meaning that it's not easy to immediately isolate them when we want to exclude them for load shedding. So we've got a plan to ensure that the ones that are not yet exempted will continue to be supported through other systems.
What is the estimated cost going to be? Because as you've just explained, isolating these hospitals, whether that is for each hospital relatively simple or whether that's a complex process, there are costs involved. So what is it going to cost South Africans to isolate these 212 hospitals from the grid so that they can be exempt from load shedding?
So far, that total number of 72, that there was no any cost incurred. But for us to exclude or exempt other hospitals, so far we are spending the preliminary network analysis conducted revealed that about 28 hospitals to be exempted or to be easily exempted, we need about 100 million rand to exempt them through building new infrastructure, meaning that we need to put up a separate transformer so that we are able to easily connect these hospitals isolated from the rest of Eskom class. So we need a lot of money, but what we can confirm and assure our South Africans that we will do everything possible to ensure that no life is lost simply because of hospitals being load shedded and there's no power supply.
The Northwest province is seriously left in the dark. Not a single hospital there exempt yet. What is the target and when is that going to change?
Yes, we've indicated yesterday that our colleagues, our officials working with the health provincial authorities in Northwest, together with Eskom technicians, they are working around the clock to ensure that the fewer hospitals in Northwest, they are exempted just like other provinces, to ensure that no province is left behind.
Well, thank you very much for taking the time to speak to us. That was Health Department's Foster Mohale talking to us about an additional 35 hospitals now added to that list of a total of 72 hospitals across the country exempted from load shedding. The ultimate target, of course, they're 212.